Hey everybody, this is Dr. Brent DeShaw, CEO of thewellrev.com, and you're on part 3 of our 3-video series of weight loss. And in our first 2 parts, we covered purity and sufficiency, which is putting the right things into your body. In the second part, we covered detoxification, which is getting the bad things out. And in part 3, we're going to cover something that's kind of a hot topic these days, which is food sensitivities. Food sensitivities are kind of an anomaly because they're relatively a recent development. And there's all sorts of theories about why they're there as far as GMOs and chemicals on our crops and processed foods and everything else. But the bottom line is they do exist and a lot of people have them. So one indicator that you may have a food sensitivity is if you've tried a weight loss program before and it didn't work. What food sensitivities do is they're kind of like an allergic reaction, but with an allergy, say you're allergic to some pollen in the air, and when you walk outside and someone's just cut the lawn, you start to sneeze, you have an immediate response. Food sensitivities aren't quite like that. It can cause a cellular immune response, but it's not going to be immediate. So it's not like you eat strawberries and you break out in a rash. That is an actually allergic reaction, but a food sensitivity is different. It's something that you ingest, but your body reacts to and can create antibodies to, and that creates chronic inflammation, and then it creates chronic diseases and can cause weight gain. So what we want to do is look at a few signs or symptoms that people may have when they have a food sensitivity. And one is going to be skin conditions. So that's acne, boils, even like psoriasis and eczema can be signs of an immune response from a food sensitivity. So skin conditions is one. Another thing is constantly feeling like you have sinus issues. You could be sensitive to milk or gluten or something like that, and that can create that constant stuffiness. So those are a couple of signs and symptoms. Again, the weight loss, the weight not coming off. If you have body aches and joint pain that are really unexplainable, a lot of times that can be food sensitivities too. So those are all just some indicators of food sensitivities. And what we're going to do is just kind of walk you through a really basic approach to food sensitivities. So I had a patient once who had a food sensitivity to gluten and dairy. And whenever they would eat pizza, they would feel tightness in their joints. And it's just kind of a weird thing to experience after you eat something, but it's a good indicator that something's wrong. So they'd feel that tightness and swelling in their joints, and the next day they'd feel lethargic or fatigued. What I had them do is cut out dairy and gluten, try not to eat any breads and pastas for 3 weeks, and see how they felt. And after 1 week of just getting off those things, they were actually able to function better, they felt amazing, and they found out they were sensitive to gluten and dairy. So one of the things you can do is if there's a food that makes you feel sluggish or makes your body ache or anything like that, just try cutting that out for a couple of weeks, and that may be an indicator that you have a food sensitivity. Again, in the purification program, we're going to deal with purity and sufficiency, detoxification on a larger level to really help the whole body out, but we're also going to deal with food allergies. So when you go through a purification program, you actually eliminate a large range of those food sensitivities, and then you reintroduce them so you can know where your problem actually might be. So if you do have a food sensitivity, chances are it's going to contribute to weight gain, and that's a good place to start. So I hope you have a great day, and I hope you enjoyed this series. Thank you.